August 2016, public speaking. My name is Audrey Headley, and as a nurse, I specialize in post-op recovery from surgery. I see everything from head to toe. But the most popular surgery that I see day in and day out is bariatric or weight loss surgery. With 40% of the United States population being overweight, bariatric surgery has skyrocketed. Everybody's looking for that quick fix. But you know what I see more every day than I do weight loss or bariatric surgery? I see complications from weight loss surgery because that somebody is looking for a quick fix and they're not willing to make the sacrifices of a complete lifestyle change. I see anything. I see gastric ulcers, I see gastrointestinal bleeding, I see people that are severely malnourished, and more than anything I see small bowel obstructions. The purpose of this video is if somebody's looking to get bariatric surgery, I want them to know that this is not a quick fix. This is something that is going to change your entire life. This is a major operation that you can develop severe complications from if you do not follow exactly what you were supposed to do. Now, the most popular gastric bypass surgery is known as the Roux-en-Y. The Roux-en-Y surgery is where they take a piece of your stomach and they cut it into a small, about 30 milliliter pouch. And then they take part of your small intestine, reroute it, connect it to the pouch, and then reconnect it to the other side of your small intestines, just like my picture that I have here. This is now your new stomach, this teeny little pouch, only about 30 milliliters, and this is your intestine. This whole part of your stomach is now just floating over there in space. This is about the size of your new stomach. This is 30 milliliters. Now the doctor will give you plenty of instructions before you go home. For the first 7 to 10 days, you're going to want to drink strictly clear liquids. You want to avoid anything high in sugar. You want to avoid using straws so that you don't develop any excess air. You want to eliminate any carbonated beverages, and you want to limit your caffeine to about 16 fluid ounces a day and try to avoid any additive sugars. Now the goal is to reach about 64 ounces of fluid per day. So now with your stomach only being this big, before somebody leaves the hospital, I typically give them a medicine cup and I tell them the goal is to drink 2 of these in 1 hour. So that seems like nothing to somebody that hasn't had bariatric surgery. But remember, your stomach is only this size. So you're going to drink 1 in 30 minutes, and you're going to drink another 1 in 30 minutes, and you're going to try to do that all day because you want to remain hydrated. After about 2 weeks, as long as everything's going okay and you're cleared by the doctor, you can start with stuff such as soup, like cream of wheat, mashed potatoes, things that are very light in your stomach. And again, you want to contain portion control because your stomach is only that big. And maybe about a month into it, you'll start eating normal foods again. But your portion sizes are not going to be anywhere near from what they used to be. And I'm not telling you there's nothing that you can't have, but you need to be smart. You just had a major surgery. You can't go and eat the sugary substances. You can't go and eat every day the fried foods. You have to think of what you just went through. You have to be smart. You want to start your diet slowly because you are healing. And a lot of people think, okay, I had this surgery and now I'm healed, I can eat whatever I want. They come in, they develop a small bowel obstruction where nothing's moving inside. Or they develop dumping syndrome where they just keep going to the bathroom, to the bathroom, to the bathroom because nothing is absorbing. And they also have to understand that your body is not absorbing nutrients like it used to anymore. You have to be on vitamins daily. And you also have to take injections monthly of B12 because that sac of your stomach that is now floating off into space used to synthesize B12, which is a very important vitamin for the body. You no longer have that, so you have to get that synthetically. As long as you follow your procedure on exactly what you're supposed to do and you're willing to make the sacrifices, this could be the greatest thing you've ever done. If not, and if you continue to live the lifestyle you were prior to the gastric bypass and you're assuming that this is a quick fix, you're going to be very sick. Your stomach can stretch. You can develop ulcers where you can't keep anything up or down. You're constantly vomiting. You can be bleeding from the inside. A lot of people I see can't stop losing weight because they didn't take care of themselves in the beginning. So now they have to be hooked up to long-term therapy through IV, and they have to get all their nutrition through IVs. So my point is that if this is something that you want to do, you need to think long, hard, and carefully. I recommend going to counseling. I recommend beginning a lifestyle change prior to this. Because if you don't start then, how are you going to finish now? I don't want to see any of you back in the hospital because you're sick. I want this to be something that is going to be successful for you so you can enjoy the rest of your life. Diet, exercise, living healthy, being healthy. That's our goal. Thank you.